Hello, I'm Dr. Igor Simonov, and today I will explain how I use Wu-Xing pulse diagnosis in acupuncture for treatment of extraordinary meridians. So here we have again the pulse map of patient who came with the few months sore throat. So this patient was visiting the specialist, otorhinolaryngologist, who didn't find anything in his throat except some small inflammation of the mucus. So this patient did not receive any treatment for this condition. What we can see here, I will remind again, here is the meridian of the lung, heart, spleen, pancreas, liver, kidney meridian. Here's the large intestine, small intestine, stomach, gallbladder, triple wormer or sanjiao, and the urinary bladder meridian. So what we can see here, we see, for example, some excesses and some deficiency in different meridians, which will be very important for us to define which extraordinary meridian we will use for the treatment of this patient. We remember that in NanJing there is the explanation that when the ordinary meridian become full, this fullness start to fulfill extraordinary meridian. So extraordinary meridian does not exist until ordinary meridian become full. So what we can see here we see some heart meridian, a little bit deficiency. Here's a large intestine meridian, a little bit deficient. Stomach meridian is in excess, and the urinary bladder meridian is in excess. What we need to do to find actually which extraordinary meridian we will use, we need to transfer this part of the pulse map to this part, and write the full organs to the NanJing organs to compare. So what we can see, for example, we can see that large intestine, here's the movement of the earth. So here in the NanJing organs, it would be, for example, in the full organs like 2 points under, so here it will be 2 points over. Why does it happen? Because this is the full organ meridian and this is the yang. So these organs, these meridians will become full when they have the excess of yang. In our case, it has the deficiency of yang. How does it happen? Because it starts to have the yin excess. So we have the 1, 2 points of excess. So in this case, we can see actually that the lung meridian, despite that in some cases practitioners can say that how lung meridian can be empty if it's there in the bottom, actually in this case we can see the lung meridian becomes empty. So heart meridian we see also deficient because the small intestine is underlined here, and if we transfer this meridian 1 point down here, it will be 1 point up. So here we can say that small intestine also is deficient. Here we have the spleen, pancreas meridian is underlined, and corresponding to pancreas stomach meridian is the actually 1, 2 points over the line. So what happens? This meridian start to have excess of yang. If we transfer it to the Zhang organ, so it will be excess of yang. Here's the excess of yin, here's the excess of yang. So it goes 2 points down. So in our case, we can say that pancreas, spleen meridian will be in excess. Liver meridian is underlined, and the gallbladder meridian is underlined. Right kidney meridian is underlined, and the Sanjiao meridian also is underlined. Left kidney meridian is underlined, and the right kidney meridian, urinary bladder meridian, is 1 point over the line, so it has the excess of yang. So if we will transfer it here, we can find that actually kidney, despite that it's in the top of our table, is actually becomes in excess. So what we can find here with that, transferring Zhang meridians to the full meridians and the full meridians reading to the Zhang meridians, we can find which meridian is in excess. What we can see, we will find that kidney meridian is in excess, pancreas is in excess. Here we can find the stomach meridian is in excess, and the urinary bladder meridian in excess. So which extraordinary meridians we will use in this case? We will find just here which the meridians they are connected and can be opened through these points of these meridians. So in our case, we can find that here is the Chunmai meridian start to become full because the kidney excess of yin start to fulfill the Chunmai meridian. And with the Chunmai meridian, we usually use the Yin Wei Mai. So we can see actually Yin Wei Mai meridian, which will be opened through the 6th point of the pericardium, also is in excess. It's actually our pulse map explain why we use together Chung Mai and the Yin Mai, Yin Wei Mai meridians together. So the sore throat actually indicate it's not the problem of the say Ren Mai meridian, Yin Jiao Mai meridian. It's the pathology of, in our case, of the Chung Mai meridian and the Yin Wei Mai meridian, which we need to open. And we open them, needling these points. And here we can see that actually which meridians we will use. We will use Yan Jiao Mai. So Yan Jiao Mai for some reason also is in excess. So a patient also told that he can't sleep well and he wake up often at night, which indicates the problem of the Yan Jiao Mai, which we need to open too. So we open Yan Jiao Mai, Chung Mai, and Yin Wei Mai meridians. Together with this treatment, we also add treatment of the Wu Xin, and we will use the sign Wu Xin, the 5, and his movements, 2 men walking to the opposite side. So we will use again the old chart Wu Xin, which people, doctors were using the long time ago. So here we have the south, north, we have the west, and we have the east. So we just put, here is the wood, we have the liver, in the 5 we have the lung, heart we have actually in the middle, kidney is the water, and the spleen is where it should be, is the earth. So according to the Wuxin rule, NanJing explained that if we have, for example, wood in excess and the metal in deficiency, we need to tonify water and disperse fire. So how we can use this rule, because there is many other alternative combination may happen, we will use the rule of the right hand. So if the index show to the meridian which is in excess, thumb will show to the meridian which will need to stimulate, we need to tonify. So in our case, is the kidney is in excess, so we need tonify heart meridian. How we use it? We use the lung meridian, because lung meridian will be mother of the heart meridian in this case, through the old chart of the Wuxin. So we use the lung meridian for tonify heart and disperse liver. In this case we have the north in excess and the south in deficiency. We will need tonify west and disperse east, which is correct, because this meridian we have in deficiency, we need tonified, and this one we have in excess. So we use the rule of the right hand, like that. And we will use the point, it will be fire point on the lung meridian, because the lung is the fire movement. And we will treat also the full organs. And here again we put all these organs in this chart. So the large intestine, here we have here's the earth movement, small intestine is the fire movement, Sanjiao is the water, stomach is the metal, it is in excess, and the gallbladder and urinary bladder, they are actually in the wood. So again, we will use the rule of the right hand. So right, putting finger like that. If we have the stomach meridian in excess, we also see urinary bladder meridian is in excess, but here we see the stomach is much more in excess than urinary bladder. So comparing to the stomach, urinary bladder will not be in excess at all. And we have also in this movement gallbladder, which is not in excess. We have the small intestine in deficiency. So what we need to do, we need to use the rule of the right hand. If we have the metal in excess, we need to tonify the fire and disperse the water, which is exactly correct, is the rule of the right hand. This is in excess, and we need to tonify this movement, small intestine. How we will do it? Again, we will do it through the urinary bladder and gallbladder meridian, using wood points on these both meridians, first for tonifying and after that for dispersing. So after this treatment, straight away, after opening meridians and the treating patient with the Wuxin, patient feel the same day much better, and he has returned for the further treatment, but he had not any more pain in his throat as he had before for the few months. Thank you.